One of the main problems with UTIs is that women often suffer from reoccurring infections. This often happens after antibiotics because it disrupts the natural balance of the microbiome. When you take an antibiotic, it not only kills the bad strains, but it often kills the good strains too. So although you're wiping out the staph, the E. coli, the Klebsiella, and the Proteus strains, oftentimes you're wiping out your good bacteria, the good lactobacillus strains that would compete with the bad bacteria and help as your natural resistance. This allows the bad bacteria to grow, and often women are stuck with antibiotic-resistant strains of bacteria. This can be a real problem, and why it's really important to use holistic protocols so that you can supplement and help support your good bacteria regrowing so you can fight the infection naturally. Remember that this video is just for educational purposes. I am not your doctor, and I cannot treat or diagnose a urinary tract infection. It can become serious. In very rare circumstances, it can travel up into a kidney infection. So it is serious and something that you may want to go see your doctor for right away. However, if you start these holistic protocols, you may not need to take an antibiotic treatment for your UTI. The first substance we want to include is water. I know it seems simple, but we need to hydrate and then hydrate and then hydrate some more to help flush the urine so that it's appropriately balanced in the pH and can help fight infections. I would say the one exception would be a green tea. So I don't like caffeinated drinks when I'm using water because they can be dehydrating. However, green tea has been really well studied that it can prevent the attachment of E. coli, which is like 80 to 90%, depending on what paper you're reading, of UTI infections. So make sure that you're drinking green tea. If you really want to have the effect without the caffeine, you can get a decaf and help flush out the E. coli and Klebsiella and some of the other bacteria through the urine. The second supplement or food I'm sure you've heard of, it's cranberry. Cranberry can be really powerful in that, like green tea, it also prevents the attachment of E. coli and can help prevent infection. So studies have been done in the colon, in the microbiome, on cranberry juice, and they even used like an ocean spray. But I would recommend a more natural cranberry juice because one of the things you don't want is sugar, and ocean spray has a lot of added sugar. But a natural cranberry juice can help give you a compound that's called D-mannose. Now, cranberry juice is not quite enough of D-mannose, so you can get a supplement of D-mannose, the compound that's in cranberry that has been really well studied to help prevent UTIs from reoccurring. You would take about 1.5 to 2 grams or 1,500 to 2,000 milligrams twice a day if you're really feeling the signs and symptoms coming on. There may be a contraindication. Make sure you discuss this with your doctor first, especially if you're on blood sugar lowering medication or have diabetes, in that D-mannose is a sugar and can be contraindicated. I would make sure to continue that D-mannose even 10 days after you don't have signs and symptoms, and you can keep incorporating cranberry into your diet as usual. Around the holiday season, when you can find frozen cranberries, they're lovely to add to smoothies. Yes, they're not as sweet as strawberries and cherries, but you can mix them in and get all the benefits of the cranberry. Finally, the third substance I would start taking right away is a probiotic. Now, the probiotic for women's health is very important to have these 2 strains. Remember, we don't want things like E. coli and staph and Klebsiella and the wrong bacteria. We want only lactobacillus strains in our genital area. So this particular probiotic is by Integrative Therapeutics, and you would order this from a practitioner. But these 2 strains, Lactobacillus reuteri and Lactobacillus rhamnosus, help keep the appropriate lactobacillus strains in the vagina and in the genital area. You can also find these same strains in Femdophilus by Jarrow at most of your health food stores. And you can insert this vaginally. It's a tiny little capsule, or you can just take it orally, and studies have shown that it does migrate from the intestines over. So this can be a very powerful way of getting your microbiome back in balance. You would take 1 capsule daily, and you could up it to 2 capsules daily, 1 in the morning and 1 at night. And speak with your doctor first, but usually probiotics are not contraindicated with most medications. So those are my top 3 holistic foods or supplements that you want to start taking right away when you have a UTI. But these are the 3 things you definitely want to omit. They are alcohol, sugar, and unprotected sex. This is why it so often happens when we're on vacation and we have a few more drinks and we have a little bit more sweets, and sometimes we have a lot more sex. So the thing is, these sort of follow the 3 things that we want to add. Alcohol can make you very dehydrated, and it can change the pH of the urine. So make sure that you're drinking plenty of water and skipping out on the alcohol. Second, sugar. Sugar just feeds the wrong bacteria in the microbiome and in all of the biomes of the body. So we want to make sure we reduce sugar, especially refined sugars. You may be able to get away with a piece of fruit and natural sugars, but let it be the cranberry to start. That particular sugar, the D-mannose, is really beneficial. And finally, I would omit unprotected sex. Try to use a condom when you're dealing with a UTI, not with a spermicide, because all of these things, the semen and the spermicide, can upset the pH, which helps your good bacteria grow and take care of the bad bacteria. That's your natural defense. So remember to try to reduce the alcohol, reduce the sugar, and use a condom when having sex when you have a UTI. That's it for today. I hope that helps, and thanks for watching.